Welcome, everyone. I am Joanna, and I'm on the board of our NAMI Johnson County affiliate. Thanks, everyone, for coming. I'm Joanna, and we're kicking off our Lunch and Learn today, 2024 Mental Health Advocacy Priorities. And Bethany Kohoutek is joining us from NAMI Iowa. She is the Director of Communications and Advocacy for NAMI Iowa. She serves as the lobbyist for our statewide organization as well. Prior to her work with NAMI, she served as the Vice President of Communications for Lutheran Services in Iowa, where she worked on policies in the area of child welfare, mental health, disability services, and refugee and immigrant programs. Bethany believes in the power of building relationships and sharing stories of lived experience as a powerful means of making policy change. So thank you, Bethany, for joining us, and take it away.
Thank you so much for the invitation. Talking about advocacy is one of my very favorite things to do, and especially with our affiliates. Grateful to you all for joining today, and I'm actually glad it's virtual on such a cold day. So I also love interruptions, and so if you have a question or a comment, feel free to unmute and put it out there. Mary and Joanna also said they would monitor the chat for me and ask any questions, so feel free to make this a conversation, and I will also try to leave some time for questions and comments at the end. I do believe that our lived experience is our most powerful tool when it comes to advocacy, and so I like to make sure there's room for all of our perspectives and comments, especially when it comes to advocacy. So let's get started, and hopefully, can everybody see that next slide? Had some issues with this before. Yes, awesome. Okay, so why advocate? NAMI does a lot of things. We do support groups, we do educational classes, we do all kinds of presentations. Why is advocacy a piece of what we do here at NAMI Iowa? Because we believe that the policies enacted and the resources and the money and the funding and all of these systemic changes that elected officials decide on do impact our daily lives in really personal and important ways. And so when we get involved in advocacy, we have the opportunity to make improvements and to make sure that the resources and the changes that are made impact us and our loved ones in positive ways. Legislators are also elected to serve us. It's their job. And they are often extremely responsive to those of us who live in their districts. So I'm guessing some of you on the call, I actually know some of you on the meeting today have good relationships with your legislators, especially when it comes to our state elected officials. Many of them are pretty accessible to the folks who live in their district and ready to have conversations. And finally, advocacy can save lives. We know that a lot of the policies that are enacted have direct impact on us and our families. The ones that I'm thinking of right now is a small one that maybe was kind of a blip on the radar for a lot of folks, but NAMI Iowa advocated for a law that would put Your Life Iowa and 988 on the back of every student ID card in the state of Iowa. And when I think about the impact that might have, even in terms of one or two kids being able to know that there's a resource there when they're struggling, I do believe that kind of advocacy can save lives. So let's get into it for this year. How does the state organization, NAMI Iowa, decide on what we're going to advocate for? Mental health is huge, right? There's all kinds of things that could be considered in the realm of mental health. How do we decide what the 3 or 4 things we're going to focus on in the next state legislative session will be? And I should mention that we'll be talking primarily here about state legislation. Our affiliates, NAMI Johnson County, NAMI Iowa, we do weigh in on federal issues when the time is right, but today we'll be talking mostly about state level advocacy priorities. So in August and September, I and sometimes our lobbyists, the rest of our team, our stakeholders are heavily involved in conversations with our peers, our affiliates. We belong to a lot of coalitions of advocates around the state, just talking about what do we think is going to come up next session and what are the most urgent mental health needs in our state that policy could impact. By October, we've put together a survey that we deploy to about 1,000 advocates across the state, asking them to rank those policy priorities so that we have some hard data on what people are most focused on in the realm of mental health. In November, the NAMI Iowa Advocacy Committee, which is made up of folks from our affiliates, lots of people with lived experience. Really, the only qualification is that you're interested in mental health and you want to make a difference in terms of policy. That's our advocacy committee. They evaluate the survey and make recommendations. And then in November, our board of directors reviews and approves the priorities. And that is turned into what you see here, which is our one-pager. This is the fancy sheet that we try to absolutely litter the Capitol with during the legislative session. We send this to anyone and everyone, from our grassroots stakeholders to our legislators to our coalition partners. I've included a QR code. There's also a link on our website. This is a great sheet to download and have ready for when you're heading into a meeting or when you have a conversation with your lawmaker. But this is kind of the result of the survey that I was talking about. So the first page is our policy priorities. There are 4 for 2024. The back page is usually just sort of doing some level setting for legislators with what mental health looks like in the state of Iowa right now. So let's dig into our policy priorities for 2024. I'm going to pause quick. Any questions? Comments? Okay. So our first legislative priority revolves around students and youth mental health, and that's to support increased behavioral health services and programs in schools for students and staff. And then we have kind of a list of some of the ways legislators have done this in the past and some recommendations that we have for what they could do in the future. As many of you are well aware, this is a big topic, and this continually rises to the top of our conversations around the state and of our survey. And so in the past, the legislature has done some things to improve mental health in schools. It was about 3 to 4 years ago that for the first time ever, the legislature required the Board of Education to require school districts to have 1 hour of suicide prevention programming and 1 hour of post-vention programming for all schools. I will say that when you kind of look across the landscape of other states, Iowa does not have as robust of requirements for mental health programming in the schools as other states do. So that's something that we hope to have change in the future. I should also mention that when I say these are our priorities, I've always been told if there's more than 3 things, people can't focus on them, especially legislators. And so while these 4 are our priorities for this legislative session, we're a week and a half into the session, and I've already registered on bills and talked to legislators about things that fall outside of the scope of this. These are sort of NAMI's front and center priorities, but we know that so much comes up during the session that NAMI's voice should be heard in. And so this does not prevent us from weighing in on other mental health legislation as well. So our second legislative priority, this will come as no surprise to many of you, revolves around workforce and our need to increase, expand, recruit, retain, professionalize the mental health workforce here in Iowa. One of the big conversations we've been having at the Capitol is really elevating peer support models. Iowa, when you compare it to other states, underutilizes peer support models in the behavioral health space. We think this is a massive opportunity for our state to help kind of plug some of those workforce holes. And so that's some of the conversation that we're having with legislators now is how do we get peers involved in every component of that care continuum, from prevention to crisis intervention to recovery? How do we make sure peers are not only involved and represented, but also paid for their work in those spaces? Third priority, identify sustainable funding strategy for Iowa's 988 Suicide and Crisis Lifeline. We know that Iowa's utilization of 988 is strong, and it will get stronger as the word continues to get out about it. I have heard some conversations that this may be in legislation that we do see from the Iowa Department of Health and Human Services yet this year. There's lots of ways that states have chosen to fund their 988 suicide and crisis lifeline, from surcharges for telecommunications carriers to just a big state appropriation. NAMI Iowa's position is that we are agnostic about where the money comes from. We would just like to see it funded. So our message to legislators now is 988 is here. It's really important. It's really well utilized. The data that we're seeing preliminarily about outcomes is good. We need to make sure this is sustainably funded into the future so that our calls and texts are answered by Iowans primarily, and we maintain that really fast call response time.
Bethany, we have a few questions in the chat.
Oh, thank you.
Yep. I don't know if, can you see the chat, or do you want me to?
I can, thank
Okay.
you.
Mm-hmm.
Are we seeing any movement on pastoral counseling instead of behavioral health? That came from Ruth. Ruth, do you want to explain a little bit more about that question, if you're able to unmute?
I had been reading or hearing that there was going to be a push to have folks who are more, quote unquote, biblically oriented doing the behavioral health services and the counseling in the public school systems. And even though I have a degree in theology, I'm really opposed to that on any number of levels. I believe our behavioral health has to be inclusive of all experiences. And I think it would be a huge mistake to have that go through. I think it might be coming under licensing and some of those bills that kind of come up every year about, I want to say, deprofessionalizing the counseling field, or deregulating the counseling field, which I believe a well-regulated field that is held accountable for their results and their actions is of benefit to the state.
Right. Ruth, this is Joanna. I've heard that too. I've read that in Texas that they are, there's a big move to replace actually mental health counselors with pastoral counselors in all the schools. And
right. And I mean, I think we need to look for that in Iowa as it's becoming more sneaky about things.
Ruth, it's interesting that you bring that up, because while we haven't seen a bill on that, a representative did bring that up to me and ask for our opinion on that, just kind of in an offhand way when I ran into her in the hallway. And so I think that you're exactly right. Iowa has had a habit of picking up bills, especially bills from other Republican majority states, and kind of just dropping them into the mix here in Iowa, and that has popped up in other states too. So I think that you're wise to be on the lookout for something like that. And I mean, that is not something that NAMI Iowa would obviously support.
Right.
We have lots of data, and that we would not be in support of that legislation if it came through, for the exact reasons that you just brought up.
Right. Thank you.
Yeah. Cindy asked if there's a reason that the state is not more interested in mental health. That is that's such a layered and nuanced question, and I'm glad you asked it, Cindy. I think that there's a realization among a lot of elected officials that mental health is in crisis, that it's really important. I think there's a couple of reasons that we're not seeing more mental health legislation. One is, I think people don't know what to do about it. I think that they see it as such a complex issue, they don't know what to do about it. And second, I think that it's gotten political, and that folks are going after political answers rather than answers that really stabilize the system. But I do have good news for you later in this presentation, because the state is proposing some pretty big changes to our mental health care system that I'd actually love to get all of your feedback on. Okay, so we can move to the fourth priority here, which is to increase access and resources to address co-occurring substance use disorder and mental health conditions. You all know, just like we here at NAMI Iowa do, that these things often happen hand in hand, and the lack of both community-based and residential, more intensive treatment options for folks who experience these co-occurring conditions are slim and tough to access in the state. And so just making sure legislators keep an eye on this population that is not currently well served in all areas of the state. There are some pockets of the state who are doing it. There are many that are not. So we want to keep that in front of them. So here's what we've seen already this year since the session kicked off last Monday. The biggest news is that after a massive evaluation by a national consultant, the Iowa Department of Health and Human Services is proposing a pretty massive system realignment in Iowa that would take our 13 mental health and disability services regions and our 20-some substance use regions and combine them into, I've heard 6, I've heard 7. The current map they have drawn shows 7 behavioral health districts. This is a big change for Iowa since we moved from a county by county system to our 13 MHDS systems, now to a proposed 7 behavioral health districts. One of the big reasons that the state is sharing that they'd like to do this is that the MHDS regions are no longer funded by property tax dollars. They are completely state funded. And so the state expects certain outcomes. Not all of the regions across Iowa are delivering these outcomes. I'm sure I don't have to tell all of you that your access to care and the equity that you might experience in receiving that care varies dramatically depending on where you live in the state of Iowa. In Johnson County and Cedar Rapids, where I live here in a suburb of Des Moines, I don't want to say I have good access. There are still holes, obviously, but I can generally access the care that my family needs. That's not the case for all of our friends in rural Iowa. The funding is also vastly different from region to region. And so what the state is trying to do is really pay for outcomes and not just number of people served. They want to see that folks who receive services are actually improving. So this is a pretty big deal. This would establish a whole new code chapter for the very first time, establishing an Iowa behavioral health system. Currently, the code is kind of chopped up and in different spots in Iowa code. What else? So I'll pause there. That's a big deal. I have a link to the whole report that I can send to Mary and Joanna afterwards that they can share with all of you if you really want to dig in and kind of geek out on the details of that. But this is a game changer, I think, for the state of Iowa. A couple of other developments. This was pretty cool. The very first subcommittee meeting of the 2024 Iowa legislative session was to discuss a bill that would establish new tiered rates for PMICs. And for those of you who are not as familiar with the child serving system, PMIC is a psychiatric medical institute for children. It's generally considered a step below psychiatric inpatient hospitalization for kiddos. There are only, it's been a while since I worked in on the child welfare side of things, but there's only about 7 or 8 of them in the state. They're all full and have waiting lists of anywhere from a month to 9 months. And so kiddos who need that intensive level of care are waiting a long time, and their families and caregivers are having to figure out how to safely manage these kiddos and their significant needs in their homes. And it's a real stressor for families, for schools, and for the system. And so the state of Iowa did increase PMIC rates 2 years ago in order to attract a more highly paid workforce. This year, there's a realization that even the kiddos who are entering PMIC have different levels of acuity and needs. And so this would increase rates for that highest level of acuity of kids. We're big fans of that. And it was really cool that the very first subcommittee meeting of this legislative session was focused on kids' mental health. So that passed unanimously out of committee or out of subcommittee, and we'll move on to the committee. So we'll be tracking that. Another thing, and if any of you watched the condition of the state address, you would have heard Governor Reynolds speak about this. This is something that advocates have been pushing for a couple of years, and NAMI Iowa is part of the Maternal Health Coalition that is working on this. This would extend Medicaid to 12 weeks postpartum. We know that women's mental health issues postpartum are underdiagnosed, are stigmatized, and are often not talked about. And so extending Medicaid, which by extension would include mental health services for women 12 weeks after they deliver a baby, would be a really big win. So there's a House bill right now that's supporting this. The governor is also introducing a bill. I've heard that they're meeting this week to kind of talk about the differences in those bills, but we are supportive of that. And then we're also keeping an eye on the Children's Behavioral Systems State Board. This board was developed to kind of hold the children's system accountable for outcomes. You may have heard in the news that as part of the government efficiency efforts, the state is proposing moving from about 256 boards and commissions to just over 100. The Children's Behavioral Health System State Board is one of those that is slated for, I'm going to put my air quotes around it, merging into one of the state councils. This is concerning to us. We believe that children need a unique and strong voice within the mental health system, because we know that kids are not just short adults. They have different needs, vastly different needs than adults do, and we think they need to maintain a unique voice. So we're keeping our eye on that as well. Check the chat here. Any other comments? Let's see, is the reorganization a constructive effort or a change, or is it a way to degrade funding and mental health services? Sarah, that is a fantastic question. And I think advocates are trying to figure that out right now, specifically because we haven't seen the bill yet. And I think the devil and the savior are in the details. And so we're expecting that bill to drop next week, and we will be going through it with a fine-tooth comb to figure out if it is a way to make constructive efforts and changes. I do think there are some really good people at HHS right now. They're very transparent about what they see as the gaps. We had a meeting with Director Kelly Garcia last week, and she was extremely open and said, our system is not well serving Iowans right now. We're failing in these ways. We've had 2 lawsuits, one from the Department of Justice about group care at Glenwood. The other was a class action lawsuit by parents of young kids who were not well served by the system and whose kids suffered some pretty dire consequences. And she was very upfront about saying, we have to make changes to this system in order to better serve all Iowans. And so I do have some faith that the folks who are making these changes at the Department of Health and Human Services, they're smart people, that they're heading in the right direction. The funding part is what we're going to have our eye on, because you can rearrange the system, but if you don't put new dollars into it, that may not lift all boats. So Sarah, good question. I'm not sure I know the answer to it yet, but hopefully in the coming weeks we will. Tara, I would look to some of my colleagues on the call for your question. That's one that I would have to dig into a little bit more. News on advanced mental health directives in Iowa. I don't know the answer to that one, but I'm going to copy it and paste it so that I can get some more information about that. Thank you for asking. Okay, so what kind of work do we do at the state capitol? We do have a lobbying team. The agency is called Policy Works. There's one other lobbyist. His name is Lon Anderson. He is like, I tease him that I ask him all my rookie questions all the time. He knows state government in and out. He knows budgets in and out. I can ask him my nitty-gritty questions about how this very opaque process works. And so he's at the Capitol every day. I'm usually there a couple of days a week. We monitor bills, we register for and against them. For those of you who haven't been into the legislature's website, for every single bill that's out there, you can click on a little column that says lobbyist declarations, and you can see all of the organizations that support a bill, all of the organizations that oppose a bill, and then those that are just kind of keeping their eye on it. So NAMI is there on a lot of the mental health bills. If you ever wonder where we stand on a bill, you can go to that bill on the Iowa legislature, click on lobbyist declarations on the left-hand side, and check to see if we're listed. If you think we should be, send me an email. There's a lot of power when we work on these things together. We've already testified at a couple of subcommittee meetings this session, and then our connections with legislators. I love it when I go in and talk with a legislator from Dubuque or from Cedar Rapids or from Iowa City, and they say, "Oh, I just met with," and then they list the name of someone at their affiliate last week, and we had a talk about this, or I just visited the Access Center, and NAMI Mississippi Valley came along. And so our NAMI affiliates are really fantastic at making connections, and that's huge at the Capitol in terms of our visibility and how seriously they take our word. So kudos to my colleagues at NAMI Johnson County and our other affiliates for really reaching out and making strong connections with local legislators. Molly Donahue is one who came to mind. Mary, this past year when we were talking about therapeutic classrooms. Let's see here. So, I mean, this is from this week already. And last week, I guess, a subcommittee meeting. By the way, if you're interested, these meetings are all on Zoom now. That was one of our pandemic silver lining developments. So if you're interested in watching these subcommittees for these bills, they're listed on the legislature's main page, and you can click and watch these meetings as they happen. You can see the TV there on the left side of the screen. So here's my favorite part. Here's how you can get involved in this work. If you scan this QR code, you can sign up to receive our legislative updates every Friday. NAMI Iowa team and our lobbyists put out a legislative update that gives you updates on the bills we're tracking, any important meetings we had that week, just sort of anything that bubbles to the surface is important in the state legislative arena. If you're really interested in kind of getting more involved, I would encourage you to join the NAMI Iowa Advocacy Committee. This is a low stakes commitment. We have virtual meetings every other Friday during the legislative session where you can hear right from our lobbyists on what's happening at the Capitol. You can share what you're hearing. You can ask questions about legislation. If we need some voices at the Capitol that next week, that's when I usually ask, like, hey, is anybody available? Do you want to come share your story next Tuesday? So it's kind of the deep dive into advocacy. If you're interested in that, send me an email. My email's there at the bottom. There really is no commitment except that you are interested in talking about mental health and learning more. We don't require you to do anything to be part of that committee. Connecting with your local legislators. Mary was just asking me about this. Our mental health, NAMI Iowa Mental Health Day on the Hill is February 20th. It's a really fun event. I'm excited about this year's programming. There's a QR code there for you to register, and I'll be sending information out to Mary and to our affiliates soon on how to register. But we get together at a local hotel in the morning and share some coffee. We have some great speakers. We have a couple of keynote speakers this year who both have lived experience with family members and close friends with very serious mental health conditions, and how they turned, in one case, a pretty significant tragedy, and another, just a really difficult situation, into advocacy, and how they both advocate at the Capitol now. We'll also go through NAMI Smarts for Advocacy, which is a NAMI National Advocacy Training Program. If you haven't advocated at the Capitol before, it can be intimidating. I still get intimidated when I go there. It's an odd process, but we make sure that when you enter the Capitol, you feel confident, you know where the bathrooms are, you know where the weird little call out slips are, you know how to talk to your legislator, and you've practiced delivering your message and sharing your story with your legislators. So we make sure that advocates feel good about their experience. And then we bus you back to the hotel where your car is. We have a little bit of dessert and we talk about our experience, which legislators we talk to. It's a really energizing experience, and it's really cool to do it together because we can usually team up, and our message is really powerful. It's cool to see people with their mental health matters stickers all over the Capitol. Oops, I'm so sorry. I just realized I missed a couple of things in the chat here. There's a bill that criminalizes mental health by default. Ruth, I would love it if you could send me the bill number on that, and I'll check it out. And then Joanna asked, what other associations or groups do you work with? That's a fabulous question. We are in several coalitions. There's about 7 active coalitions that NAMI Iowa works with. I mentioned the Maternal Health Coalition. We're part of the Iowa Continuity of Care Coalition. Right now, the big issue there is making sure that insurance companies can't change someone's prescription in the middle of a plan year. So if I'm stable on my medication for my bipolar disorder, my insurance company can't say, oh, it looks like there's a cheaper generic alternative. We're going to stop covering your medication and force you to switch to the generic in the middle of a plan year. That's legislation that we're hoping to get passed this session with them. We're also, NAMI Iowa is actually the co-leader of the largest children's mental health initiative in the state. It's called CAMI for Kids, the Coalition to Advance Mental Health for Kids. We just love acronyms in the mental health space, don't we? Big, long ones usually. We are active in the Medicaid Matters group. Mental Health America does not have an active lobbying presence here in Iowa. I know I share their resources a lot because they put out some really great reports. The Iowa Nonprofit Association, we work with them. Is there a state group that represents the community mental health centers? There is. That question's a little bit tricky because they're scattered a little bit. There's a couple of community mental health centers that have their own lobbyists, and then there's some that have sort of banded together. Link for the advocacy.
Joanna, that's unfortunate because I think, you know, they were very strong in Colorado and they brought all the mental health centers together. And so when these regions get rebuilt, which happens a lot in other states as well, they, you know, they work hard to make sure that the outcomes that they're asking for don't result in more bureaucracy, right? I mean, we ended up as a community mental health center hiring people who could just handle the outcomes, right? And that's one less person to serve. And so, because, you know, community mental health centers aren't just rolling in money. So it was just, it really required that we had to cut a couple providers so that we had analysts on staff to make sure we were meeting all those outcomes, sending in the numbers, and they constantly changed those requirements and expectations. And it was, and the lobbying group, what they did was really make sure that those were more streamlined, and that was good. But they, NAMI was not as strong in Colorado as it is here. And so and Mental Health America and NAMI often, you know, kind of battled, I guess, for space. And so it was a confusing sort of zoo, if you will, for lobbying efforts. Here, NAMI seems very strong, and that's it's so good to see. And I really appreciate all your efforts to try to corral some of the various concerns and needs that are so apparent here.
Your point is well taken, Joanna, around making sure that in our rush to kind of provide more services that we aren't overburdening providers. And I think your point about community mental health centers, we have our eye on that with the state's move to CCBHCs, certified community behavioral health clinics, which is kind of the state's next vanguard. That's supposed to be an open door for everyone, kids, adults. It is supposed to be kind of the one stop for mental and behavioral health services. And I think there's actually a list of 149 federal requirements that those CCBHCs have to comply with. We're still waiting to hear if the state of Iowa will get the demonstration grant dollars for that, but the state has made it pretty clear that they're going to move in that direction regardless. I don't know if anybody here on the call has more information about the CCBHCs. I just got the list of.
I was at a community mental health center that worked to get that certification. It's not easy. It's not easy at all. But we also, we had 500 employees and served, pregnant women all the way to seniors, and it was a very strong and large community mental health organization.
That's incredible.
I don't see any of that here, and it's unfortunate.
Well, and I do think that that's why the state is trying to make these changes, is because they see a lack of accountability. They're not seeing the data that they want to see from the regions. On the Medicaid side, we have more data, and they're really trying to streamline that. So no matter who you are, no matter what insurance you utilize, they called it a bright, shining doorway, where you understand how to get into the system, and then you have kind of a clear path and case management through the system. It will not happen overnight. I think it'll be messy before it gets clearer, but that's how they've explained it to us.
Yeah, and it's about asking the people who use the services what if they feel like they're getting better, and that's the critical piece, right? I mean, it's not the opinion of some state official or some analyst sitting in an office somewhere in a community behavioral health center. It's really should be up to the person using the services.
You hit the nail on the head, and we continue to bring that up in our conversations with the Department of Health and Human Services, and also with legislators, that people with lived experience, parents, peers, partners, spouses, they have to be at the table. It's critical that during these system changes that these folks, we are at the table, because our experiences will help to make the system better ultimately. And they did take a lot of feedback into consideration as they were developing this recommendation. They pointed to, and I wish I could pull up the slide quickly here from their slide deck, but they did a lot of community forums. They had folks with lived experience on their committees and their panels and things like that. But we want to make sure that remains the case moving forward. That's a really good point.
Yeah, thank you.
So this, I always just point this out at the end of presentations, but just making sure you know who your legislator are. They change every couple of years, obviously, not in all of our districts, but in some of them. So it's the legislative website, legis.iowa.gov, sorry, has a great tool. You pop your address in, it spits out who your state senator and your state representative are. I recommend signing up for their newsletters. If you're on social media, follow them on social media. If you sign up for our weekly legislative alerts, I always include a big list of town halls and legislator forums, so you can, show up at their events, start to build relationships with them. Like I mentioned, Iowa's a small enough state that if you start a conversation with your legislator, you can start to build a relationship. I often, if I see something in the Press Citizen or the Gazette or the Des Moines Register or on local TV that has to do with a mental health development or a need, I will email that link to my representatives and say, hey, Representative Andrews, did you see this? It was just in the Des Moines Register. It really highlights our need for more behavioral health workers in the schools. You know, let me know if you have questions, just to kind of keep NAMI's name and to keep the relationship going. So again, they are paid to listen to us. So let's utilize that. And that is the end of the presentation. So I'm really grateful for the conversation, and now I would love to hear from all of you. Do these priorities look like the things that are important to you all? Feedback, questions you have about the process or NAMI's role in it?
I have a question about red flag laws. Are there any kind of, is there any discussion about that? I know that they're problematic really they add to the stigma of mental health. Unfortunately, but they're also a way to get at some kind of gun legislation.
Yeah, really good question. Iowa voters passed a amendment 2 years ago now that makes passing additional gun control legislation extremely hard in this state. And so, in fact, it's one of the toughest states at this point to introduce new gun control legislation. And so you mentioned that we actually had a red flag law recommendation in NAMI Iowa's legislative priorities last session. And then when the voters passed that amendment, we took it off because we were told that there was little to no chance that Iowa would be able to pass a red flag law of any kind due to that amendment. And so advocates and mental health advocates are talking about ways that we can figure out common sense solutions that still, work within the system we now have in Iowa. There have been some ideas floating around, but it's, to be very candid, it's a difficult, it'll be difficult given the amendment that was passed, and then also just politically right now in the state, anything that is seen as restricting guns is a tough bet.
Right. Yep, I see that. Plus, as I said, it is problematic because you hear some of the reasoning behind it, and it really adds to the stigma of, it conflates mental illness and violence, which is always something we fight.
You're so right. We constantly point out that people who have mental illness are so much more likely to be the victims of violence than the perpetrators. And that's a statistic that I share often. And it sounds like you all do as well.
To the last question, it seems like if there were a way to have an advance directive, much like people have advance directive for their physical health, if they could if that would be accepted by law, that if somebody, when they're feeling well, that they could write their wishes and have it signed and notarized saying that, yes, I want this person to be able to make decisions for me, or yes, I like this certain medication. It's helping me. And then if that advance directive could be something that was accepted, it seems like that could also prevent a lot of unnecessary suffering. It's just my opinion.
That's really interesting. And I will admit, I don't know much about that. So if that's been something they've passed in other states or that NAMI National has worked on and it's passed me by, I would love to get more information about that. Really interesting. If you have any links or any additional kind of perspective on that, could you share that with me? It's really compelling.
Sure, I'd be glad to. I have some links from Minnesota.
Okay.
I don't think it's something that's universally accepted at this point. I think it's something that people do and hope that it will at least streamline the process. Like when it does go to court, let's say if somebody goes through the commitment process and, and then it goes through the court, that it would make it streamlined so quickly rather than be a long process. But I think that ideally, just I don't think it's something that's really used a lot right now, but I think in the future, it seems like it could prevent a lot of unnecessary suffering where a person, when they're feeling well, they could be, and they could have several witnesses and maybe even a doctor say, yes, the patient is now feeling very, clear-minded and thinking clearly and functioning very highly. And they say, I like this particular medicine, so that if they don't feel well, they miss a couple of doses, and then they say, I don't want my medicine, then, that could be something that could be implemented without going through the process. I think right now, it's something that's just streamlined the process a little bit. But I think ideally it could even prevent it even from going to court. But that's something I don't think it's really being used yet.
Yeah, thank you. That was Tara, right? Who was speaking?
Yes.
Yeah, thank you, Tara. And I put my email there in the chat. So please send me those links and I will educate myself on that and would love to continue that conversation.
I see Sarah Ross provided some here. Thank you. Sarah.
Ah, yes. Thank you, Sarah.
Oh, that was on the, yep, certified community behavioral health clinics and
Oh, yeah, this is great. And the advanced directives too. I would encourage all of you to join us at Day on the Hill. I know several of you have been in the past, and I'm so grateful for that. We try to take really good care of people while they're here to make sure everybody has a good lunch and a positive experience. And it's just nice to be together in person. All of us kind of talking about the same things. And it's exciting. It's exciting when you have a good conversation with your legislator, and then you get to come back and say, I talked to them and they agree, or they're gonna vote for this. So please consider joining us on February 20th. And please consider joining the advocacy committee meetings, even if you just want to listen in and hear what's happened in the last 2 weeks at the Capitol. Can also talk to your folks at NAMI Johnson County. They are dialed in and very active, and we at the state office are so grateful for the big visible presence that you all have in Johnson County and really kind of all throughout Eastern Iowa. But just awesome connections, well respected. Very much appreciate that. That makes our work easier and more fun.
thank you. We have a great executive director.
Amen. So Kira asked, where can we find links to the advocacy meeting recordings? We don't actually record our NAMI Iowa advocacy meetings. I'm wondering if you mean these meetings here, but the advocacy committee meetings, we don't record those. It's kind of a show up and hear what's happening. If you can't make it, no big deal. They're only 30 minutes every other Friday.
How do you join those? Do you?
Send me an email and I will add you to the list. And just say, I'd like to join the advocacy committee meeting, and then you will see, I'm putting my email in the chat one more time. I'll just forward you the meeting invites. They're all Zoom, and then you just log on when you can, hear the updates, contribute when and how you can. And then you get to kind of decide your level of participation from there. And so really, it's a pretty small group. We usually have between, sometimes there's 5 of us and sometimes there's 20 of us. But it's a nice intimate space where you can really ask some questions and share some perspective.
If you just Google NAMI Johnson County YouTube channel, you can definitely find it and subscribe.
Yes, and our weekly email newsletter has links to it so people can subscribe.
Great, thank you. Any other questions? Did we miss any? This is wonderful. Thank you so much, everyone, for coming. We have one more. That was a thank you. Yes, we really appreciate you coming, Bethany, and there's a lot of interest in this, and we hope that you can move things forward for everyone in Iowa. And thank you for working so hard to do so.
Thank you all for your work on this too. I am excited to be working together with you this session and beyond.
Great. Thank you. Thanks all. See you next month. We've got an interesting topic. I've got to look that up. We're going to talk about clubhouses. What is a clubhouse? What do we do at a clubhouse? And really, it's not a drop-in center. It's a very different kind of concept. And there are many clubhouses all over the world. And I'm going to be bringing in executive director of a clubhouse in Colorado who's very successful and actually now working for Clubhouse International. And she'll be talking about how to start one. Not sure we want to start one here. It's a lot of work, but we can also put that in our dream basket for later. All right. Thanks a lot, folks.